Overall, our main mandate is to ensure access to health and social services for the English-speaking population in Quebec. And our specialty is the English-speaking Black population. Because as we know, access to services is really important when it comes to language, but we also have found that culture plays a really important role as well. It is a right, and everyone who would like to have access to services in English has a right to do so. Institutions that offer services are required to develop a program that ensures access to services in English. So simply put, institutions have to let the population know what services are available in English, where they can get them. And there's also a piece kind of governing the delivery of services with regards to the recruitment of those who will be delivering the services and access to personnel who speak in English. There are certain institutions that are designated to provide services in English, and that list is provided as part of the access program so that people know which institutions they can expect to receive those services in English. We try to build relationships with the public system. We believe really strongly in what we call the warm referral process. So the more kind of relationships we can build with those who deliver services, the easier that kind of challenge becomes. We're also really active when it comes to users committees and any kind of surveys or focus groups that are being done to kind of improve services. We're always kind of there with our hands up, representing this particular population who is, very vulnerable and often can encounter these challenges. Bill 10 did present some challenges in that what was a kind of a huge system became kind of even bigger, so which that makes it harder to navigate. On the other hand, if you can implement changes that improve access, then you're touching a kind of on a more global scale rather than working with individual institutions kind of one at a time. The push to kind of accept adaptation as part of policy is kind of where we want to go, because if everybody can kind of acknowledge that adapting services, specifically in the healthcare system, when you are in accessing services, there's oftentimes a crisis situation. And just on a human level, if we can all agree that we would like to serve people in those situations in a way that makes them most comfortable.